One of the first people to contact me when I became an MP was the experience of getting a service on a Sunday. A resident of Ashby was given an appointment and out-of-hours service in Leicester City. The taxi cost just one way was about 40 quid. It's just one example how the rural penalty is actually creating real problems in healthcare. But I was glad to see the Minister in his place because I wanted specifically to focus on pharmacy and it being his area of responsibility. I've met many of my local pharmacists over the time I've been a Member of Parliament. And our community pharmacies are often our lifelines, yet access to them isn't equal and certainly not simple for many of my constituents. North West Leicestershire isn't just a semi-rural constituency, but proud post-industrial one too, with a strong coal mining past. However, this means that we have our own unique health issues, particularly respiratory. Asthma, for example, is higher in my constituency than the average of the East Midlands, and for the whole of England, with 8% of my constituents living with asthma. Many residents rely on regular inhalers and medication reviews and preventive advice delivered via their local pharmacy, a vital service. But if the local pharmacy is facing a shortage or a rural pharmacy doesn't open as frequently, it can have detrimental impacts. When it's like in a city, you can pop along the road to the next nearest pharmacy. Castle Donington, with the highest rate of asthma in my constituency, has just one pharmacy, and they're doing an amazing job for my constituents, but the next pharmacy is more than 5 miles away. And with 62% of our bus services cut under the previous government, it's not that easy to just hop onto the bus to the nearest town. The isolation of our pharmacies has a detrimental impact if you're in a rural area because there's just simply nowhere else to go. So when patients cannot access their medicines promptly, their conditions can worsen. They will turn to a GP, they will turn to for urgent appointments or to their nearest A&E. And pharmacy provision can provide us with an invaluable capacity for our entire healthcare system